Hi, Melissa. This is the pediatric assessment that you asked for class. I do not have a doll, so I have created a monstrosity behind me here. And this will be our patient. So, just getting started, the first thing we're going to do is when we enter the room, we're initially going to note the patient's facial expression. We're going to note their skin color. We are going to note their work of breathing and their if they have any odors emanating from either body odor or breath. If this is a toddler, we're going to note their activity level as well as if they speak back to us when we speak to them. If this is an older child, we are going to note um, their mood. We're going to note, I think I already said facial expression as we entered. Um, but we're going to go over their orientation, them being oriented to time, person, as well as place, so we can ask them questions like, you know, what day is it today? Do you know where you are? We can ask, who the person sitting next to them is, which would be a parent. And then we will also check their memory, so that will be recent and long-term memory. We could give them a word to remember and ask them that a little bit later on in the assessment. We could ask them what they had for breakfast this morning and what they had for breakfast yesterday. So those are the things that we are going to do with our general impression and the appearance of the child. Moving on, we're going to take the vital signs for the child. So we will get a blood pressure on the child. We will check their pulses, and we're going to check their pulses everywhere. That'll be the carotid, brachial, radial, femoral, popliteal, and down here is the towel I rolled up for their leg, but also their dorsalis pedis. We're going to be checking for both the rate and amplification of those pulses. We are going to take a temperature, so we can take it tympanic temperature, which would be up here at the head. We can take an oral temperature at the mouth, and we can also take a rectal temperature, which is not what I would want to do meeting this child for the first time. Continuing on after the temperature, we are going to check the respiration rate. We're checking for both the rate and tidal volume. And then we are going to check their SpO2 to make sure that their blood oxygen levels are good. And after that, what we'll do is start our secondary physical exam. Here, let me sit so you can see my head. We'll start our secondary physical exam. If it is a small child, we do want to start from the feet to the head. I think this is an older child, so we'll start from the head to the feet. One of the things with children that you want to check that's different than adults is that we are going to check their somatic growth, which would be their length, their weight, and the circumference of their head. So we will check those things. Continuing on, we're going to check the skin, and I will be checking the skin all along this physical assessment. So we're going to be checking for all of the decap BTLS, the color, making sure it's not mottled in any areas, and the temperature as well. And I think that's all we're checking for the skin. Um, so yeah, I will give them a once over looking at the skin. I'll feel the temperature of the skin. Even I know we took a temperature, but I'm still gonna feel the skin as we go along. So starting off, the first place we are gonna start is the head, and so I'll take off little Jimmy's hat here. And we're going to start with the hair. So I'm going to check the hair, the scalp, checking just the skull and the integrity of the skull. If they were a child, we'd be checking for, if they were a younger child, we'd be checking the fontanelles, seeing where they are as far as being closed up. So I'll check all that. Then I'll come down, check the facial bones, checking above the brows, checking around the eyes, cheekbones, the mandible, um, just checking all those bones there. Then at the eyes, what we're going to do is I want to make sure little Jimmy is seeing all right, but I'm going to check the sclera of the eyes, making sure that they're white. I'm going to check the iris. I'm going to check for the reaction of the pupil. And then what we will do is I will check how the patient is seeing. So I'll come over here and I'll hold up some fingers and ask him how many fingers I'm holding up. He'll let me know. I want to make sure that it's not looking fuzzy or anything like that. And then I'll also check the movement of the eyes by doing the H and having the patient follow my finger as we go. Um, that should all come up well there. Then we're going to check the nose. I'm checking for any deformity. And like I said, as I'm going along, I'm checking the skin in all these sections. So I'll check the nose for any deformities, and then I want to check the air movement of the nose as well. Coming down to the mouth, I want to have little Jimmy open his jaw, make sure that there's no clicking, no popping. Hopefully, I should know by now if his airway is patent, but I'm going to make sure there's no gum or candy or anything like that in the patient's mouth, and that he does have a patent airway, as well as checking the mucosal membranes, making sure they're moist and the proper color. I forgot earlier about the skin as well. For the skin, not only are we checking the temperature and the color as we go, but we're checking the moisture. We're checking for turgor. I think that's all I missed there. But after the mouth, what I'm going to do is check the ears. So I will check the outside of the ears, checking for any deformity there, check behind the ears. I will look into the ear canal and actually check in the ear canal. And then what I'll do is check the patient's hearing. So how I'll do that is I'll stand behind him. I'll let little Jimmy know, raise your hand when you hear me on either side, and I'll slowly come in with a light tapping until little Jimmy raises his hand, and I'll do that on both sides to make sure that his hearing is adequate in both sides. So next we're coming down to the patient's neck, and at the neck, I'm just going to be looking for any deformities. I'm going to check for any tracheal deviation. The trachea should be midline, and those jugular veins, based on how he's sitting, should be pretty flat, so I don't want those to be any pressure there, any extension in those jugular veins. So coming down the neck, we'll come over to the chest, and I'll open up his shirt, which he has a pretty funny body, I would say. So I will check his collarbones, coming down just on that thoracic cavity. I'm going to be checking for any bruisings, any tenderness that he's having. Don't want to feel anything sticking up. Checking that skin, like I said, for the moisture, the turgor, any decap BTLS as we go. Um, and everything looks good. So what we'll do, since we are here at the chest, is I will listen to his lung sounds at this point, and I will listen to the tracheal, bronchial, bronchovesicular, and then vesicular. I'll do that on both sides, and then I'll also have him lean forward and check the lung sounds on the back. Also, since we're here, I'm just going to go ahead and check his heart sounds, which we'll be checking the apical pulses, S1 and S2. And all that sounds good. So we will come down now to the patient's stomach. What I want to do first is look at this area. And I'm going to be looking for any deformities. I want everything to be symmetrical, and that's for his chest as well. There should be symmetry there. As chest, we should be seeing that breathing, so we should be able to see the expansion. And I know with children, they also tend to be more stomach breathers, so we'll see the expansion there as well. So again, I've looked. I'm not noting anything. Next, what I'll do is listen, and I'll listen to all four quadrants of the stomach, and that's just to make sure that I'm hearing, bowel movement, basically, or bowel sounds, not movements, sounds. After that, that's when I actually come in and palpate the area, checking for any rigidity, tenderness, any pain, anything like that. I don't want to feel any lumps or anything. It should be pretty good there. Next, what we'll do is I will come back up to the arms, but I'm going to check the pelvis first. I'm going to check for stability by pushing in and down, again, making sure there's no pain there, um, and making sure that the skin there looks good. Again, there's no decap BTLS. Everything should be symmetrical. At this point, maybe with the help of mom, and I'll explain everything to little Jimmy. Hey, we're gonna have to check your areas. It's just a quick look just to make sure everything's looking right. So we will be checking the genitalia for any rashes, lesions, any drainage, anything like that. Um, Now that we're there, what I'm gonna do is I am gonna come back up arms. So I'm going to check the arms, feeling along the way, looking for any abnormalities, checking the hands, the fingernails, making sure that's clean. And I'm going to do that on both sides, so coming down, check in, not feeling anything off. The skin looks good. Fingernails on this hand look good. Everything looks good. While we're here, what I'm going to do is listen to pulses. So I want to go back and listen to that carotid pulse, as well as listening to my brachial pulse and my radial pulse on both sides, just to make sure I'm not hearing anything funny. There's no whooshing noises, because that could be bad. And then I want little Jimmy to move his arms. I'll probably have him do some circles, forward, backwards, just to make sure that he has symmetry in his movement. Um, and there's no lack of movement anywhere. So then we'll come down and we will check the patient's legs. Like, push this down so you can see his towel legs. Okay, so we'll check the patient's legs. And again, I'm coming down, just checking, making sure no decap BTLS, the skin looks good, he's got good turgor, it's moist, it's warm. Um, There's symmetry in the legs, making sure they're the same length. At this point, I want to both feel the popliteal and dorsalis pedis pulses on both sides, as well as, I'm not sure if it's necessary, but I'm going to go ahead and give those a listen as well. At this point, I want to make sure that my patient has symmetry in his legs and good movement in his legs. So I might have him stand up and walk. I might have him, kick his legs up, um, have him wiggle his toes, make sure that everything's good there. He has feeling all the way down across his legs, and make sure that is all good. At this point, I think all I have left is the patient's back. So I'll have little Timmy sit forward, and I'll go down his spine, making sure there's no step off. Again, I want to see that everything looks symmetrical. I don't want there to be any bruisings, lesions, scars, anything like that, and that's what we're checking for. Checking the skin on the back as well, um, making sure that he has no tenderness and no pain on his back. Um, Other than that, I think that will complete my pediatric assessment. And again, sorry that I didn't have a doll. I just don't own one, so you got stuck with my weird creation. But yeah, that's it.